Even with a short break for the Memorial Day holiday, momentum is building around several key bills that could impact your business and your community. From childcare reforms to healthcare transparency to new tools for local development, here's a look at what's advancing through the General Assembly. You're watching the Matthews Area Chamber Advocacy Update, sponsored by Atrium Health. I'm Brian Francis, and it is June 2nd, 2025. The General Assembly did not convene last week due to the Memorial Day holiday, so we're going to take this opportunity to catch you up on a few of the bills of interest that have been moving. Specifically, we're going to talk about four bills recently passed through the Senate Committee on Healthcare that had proposed committee substitutes, so changes to how the bill is written compared to when it went to the committee. And those bills are now headed to the Senate Rules Committee. House Bill 434 initially focused on streamlining the prior authorization process for health insurance, but the Senate version now focuses on healthcare price transparency. It requires hospitals and ambulatory surgical centers to publicly report costs for common procedures and insurer reimbursement rates, and that should help patients make more informed choices and could potentially encourage greater competition. House Bill 67 targets one of the fastest growing drivers of healthcare costs, prescription drugs. The bill strengthens oversight of pharmacy benefit managers, or PBMs. Those are the middlemen that negotiate drug prices on behalf of insurers, and this bill would ban spread pricing, increase transparency around rebates, and require detailed reporting. That could potentially create greater clarity and potential savings on prescription drug benefits. House Bill 412 originally focused on childcare regulatory changes like staff ratios and equipment standards, but now it also calls for a plan to decouple childcare star ratings from the state's subsidy reimbursement rates. This proposal highlights the push and pull we sometimes see between quality and quantity in childcare. While the proposal could increase the availability and affordability of childcare for workers on the lower end of the economic spectrum, it also could potentially be at the expense of quality early childhood education. And House Bill 309, that directs the Building Code Council to create a new occupancy classification for family childcare homes. The Senate version expands the bill to ensure consistent treatment of these homes, whether they're in traditional houses, buildings governed by the state building code, or manufactured homes. And finally, Senate Bill 695 would create a new property tax abatement tool to support private development. Developers could propose an incentive district covering up to 5% of a city or county's land, subject to local government approval. Within these districts, 90% of the value of the land and new unoccupied buildings would be exempt from property taxes for up to 10 years or until the property is sold. The exemption applies only to new construction and is intended to encourage development in underutilized areas. Because local governments must approve the district, the bill creates a partnership model to support targeted growth. That bill passed the State and Local Government Committee and is now headed to Finance. Well, that's all for today. We'll continue tracking these policies and others that could impact businesses in Matthews. Until next time, I'm Brian Francis, and this has been the Matthews Area Chamber Advocacy Update, sponsored by Atrium Health.